Good evening. It's Bronwyn. We're back here with Black Mental Health is Black Health. And we have an exciting guest tonight. And we're going to be talking about our physical health and, of course, how it relates to our mental health. But you know what we do? We get started with a few deep breaths, cleansing breaths that puts more oxygen in our brain and throughout our body. So let's take those 3 cleansing breaths. Are you ready? Breathe in, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 2, 3, 4. One more, in, 2, 3, 4, out, 2, 3, 4. Just those cleansing breaths to get us started. We're going to be talking about our heart today. You know, it's February and Valentine's Day is tomorrow, and we're thinking about, that part of our heart being all in love. But our heart is a real muscle and a real part of our body, and it totally impacts our health. So that's what we're going to talk about tonight. So, as I always do, I ask my guests to tell us who you are and tell us something cool about you. So we'll get started.
All right. Hey, everyone. Hi. Hope everyone's having a good evening. My name is Jenny O, or Jenny Olaleye. I am first generation American. So you may wonder, where is she from? So born and raised in Dallas, Texas, but parents born from Nigeria. So something cool about me. I like to travel. That's my thing. My people know me. I have been as far as pretty much most of all the cities in Texas, and I've branched out to 4 of the 7 continents. So, and I have my travel wall, and I'm excited about it. So I get a shot glass everywhere I go, and I'm just kind of putting all that together. I would say the furthest I've been would be Dubai, and that was a 16-hour flight. Loved it, but yes, I'm a traveler. I like to go. There's just so much world to see, so I like to go when I can.
Awesome. Have you been back to Nigeria where
I
your parents?
actually have, yes, 3
What
times, yes. Sorry,
where
what you
where are they from in Nigeria? Your family?
Just Nigeria.
Cool.
Yeah,
Um,
yes,
you are a nurse practitioner, correct?
yes,
Now, I
yes.
believe you're an advanced nurse practitioner. What does that mean? Because we hear terms, and I like my audience to really get the nitty gritty and have an understanding. So, can you explain what it is?
Yes, so I'm a registered nurse, but when you're an advanced nurse practitioner, you went to school after your BSN, you got your master's degree, and my focus was in adult gerontology, so older adults, acute care. So acute care, we deal with cardiology, and that's my specialty, but you can also deal with the lungs, the kidneys, you can work in the hospital, you can work in the clinic. So we work very closely with our doctors, and what we do is we provide care, we assess our patients, we diagnose, so we let them know what conditions that they have and how we can work on treating that. So I work very closely, like I said, with my doctors. We order testing, we order blood work, and just to keep our patients healthy and how to manage their chronic diseases. Just because you have a disease, it doesn't mean we have to just let it, eat us up, just eat us up. But what we do is we help control it and manage it. And nurse practitioners can work in any environment. So you'll see them in mental health. You'll see them in, like I said, cardiology. You'll see them in a hospital, rehab. So we're all over just to be a resource to our doctors, but also even more an advocate for our patient.
Awesome. How did you choose cardiology?
So I don't, you know what? It's so funny. There's this saying that tell God your plans and then he'll just laugh at you and he'll say, ha ha ha. But I remember when I was in nursing school, this was back in 2007, and we had our subjects, and cardiology was the hardest for me because it was so complex, but it was the most interesting. And I was like, oh, I don't know if I even want to even go cardiology route. But that section I did the best in. And everybody was like, wow, how'd you ace the cardiology exam? I'm like, I have no idea. My first job, I had a few interviews. The first one that called me back was a cardiac telemetry floor. with Methodist. So I end up working in cardiology, and I've been doing it since 2009. So that's why they say you just never say never. But at one time I was thinking this is just too complex. I don't know if I have any interest in cardiology, but that's where God led me. So yes, and I love it, and I've been doing it since. And the heart is a muscle that affects every single organ in our body, and I just have that love for it, and there's just so much behind it that you can grow and learn. And what we were doing 5 years ago is different from what we were doing 10 years ago. So it's just ever changing. Yeah.
So let's get right into that. When I think of the heart, and when most people do, we know that blood pressure and cholesterol impact our heart. So
Mhm.
tell us about that. In the African American community, blood pressure and cholesterol are issues. So
Yes.
to kind of dig into that, how do they impact our heart? We just know, I got blood pressure, my numbers are too high. So what is that?
Yeah, so if you look at just a little bit of background, first of all, heart disease, unfortunately, it kills. It's the number one killer of both men and women. um doesn't matter what race, it doesn't discriminate. So yes, definitely among our community, because there's not a lot of awareness that is missing, but it's the number one killer for men and women across the board. They say 1 in 2 people will have some form of heart disease. Now you say, okay, what is heart disease? Think of like an umbrella, and heart disease can incorporate high blood pressure, it can incorporate high cholesterol, and it can incorporate diabetes. And some people say, well, diabetes, yes, it can. Because when that sugar attacks those arteries, it can do a lot of damage. Okay. So it is an umbrella that a lot of people are affected. And you'll see that you'll start seeing genetic components. So you say, oh, so and so had high blood pressure, my grandmother, my father, my sister, my this. So it can be easily turned around. But the hard part is just knowing it. And like you said, high blood pressure is one of those things where there's no symptoms for a long time. You may have a general headache, you may have a little bit of tiredness, but your blood pressure can be high for years without even having any inkling that, hey, my blood pressure is high. So that's why it's important, why we have to take care of ourselves. We have to raise awareness, like what we're doing right now. It is Heart Awareness Month. You have to get plugged in with a doctor, primary doctor. Let someone check your numbers. Okay. Blood pressure can do a lot of damage. The higher your blood pressure is, the more damage it can do to your main arteries in your heart, the arteries in your brain. It can damage the arteries in your kidneys, and it just keeps going on. The damage just keeps being, keeps happening. And sometimes there may be no signs until it's too late. And that's why really even young kids are starting to get checked now and screened. So I encourage you, yes, please get your blood pressure checked. Please know what your cholesterol numbers are. And same thing with your sugar, with diabetes. Know what your numbers are so that we can reduce the damage.
So let's talk numbers.
Okay.
Let's start there.
Yeah.
What are numbers? What are good numbers? We know we're supposed to get a check, and we know when they're in the hundreds, that's too high.
Mhm.
And does it matter with age or what? Let's just do blood pressure right now. Tell me about blood pressure numbers.
Okay. So if you look at blood pressure, your ideal blood pressure should be 120 over 80. Now, that can vary depending on how young or how old we are. So usually I encourage my patients 120 over 80 plus or minus 10 to 15 points higher or 10 to 15 points lower. And that's why it's important for you to get plugged in with a doctor so that way they can help you manage it. Yes, you can have an idea on how your normal blood pressure should be, 120 over 80. But if you have a doctor that's managing it and you are checking it at home from time to time, you can help yourself and say, you know what, normally I've been checking my blood pressure and I'm 130 over 80. My doctor said that's normal for me. That's fine. That may be normal for person A. But another person, maybe they have some other heart conditions going on and their blood pressure needs to be closer to 110 over 60. So you have to have that relationship with your doctor and know what's normal for you. And then when your doctor does have a plan in store for you to say, hey, this is what your numbers should be, you should check it, be your own advocate and check it at home, because you may see your doctor only once, twice, 3 times a year. But if you're checking it at home on a daily basis or a weekly basis, you can tell your doctor, hey, let me give my doctor a call. my blood pressure is normally 130 over 80, but now I am 160. That's not close to my norm. Let me let my doctor know. Let me get an appointment and get checked out and let's see what's going on. Okay.
Before we leave numbers, I wanted to ask this. We know about high blood pressure. What if
Mhm.
it's too low? Is there such a thing as low blood pressure?
Oh, yes. Oh, yes. So low blood pressure can be just as dangerous as high. So when you think of the dangers of high blood pressure, it can damage your arteries, like we just said, through your heart and your eyes. It can even cause a stroke. If your blood pressure is too low, you run the risk of not getting the blood pressure is too low. It can't get enough blood pumping to the rest of the body, which can be dangerous. And your body's lacking the amount of pressure that it needs. It can also make one very dizzy. It can make you pass out or fall out or faint, which can be very dangerous because you wouldn't want a low blood pressure while you're driving on the highway.
No.
Yeah. So, and that's another reason why you should check it kind of, in a routine manner. So that way you can say, hey, this is a little lower than my usual. Let me let someone know. So it's all about numbers. Okay. And knowing
Okay.
what's normal for you.
How often should one check their blood pressure? You have it at home and you check it, but how often should you do that?
I encourage just a general, if you're taking high blood pressure medicine, you really should check it maybe like I would say once a day or every other day.
Mm,
Okay. Now there are some people, your blood pressure has been controlled for so long. You already have maintenance. You've been on the same medicines. There's no issues. You may be on that medicine. You may only need to check yours once a week, but the average person should at least do it once a day or once every other day. And then there are some that we care for that the blood pressure is so up and down that we encourage them to check it sometimes 2 or 3 times a day just because of their condition. So
mhm.
once again, having that relationship with your doctor and they will help guide you.
So if you don't have any blood pressure issues, should you still check it once a week?
Very good thought. Yes, you should. You should because things can happen. Blood pressure can go up when we're stressed. Blood pressure can go up when we drink a lot of coffee, caffeine. Blood pressure can go up when we have maybe we're not getting adequate sleep. Blood pressure can go up if you eat something salty and check your blood pressure right after. You will see it creep up a little bit. So yes, I encourage everyone. If you're over the age of 18, you
Mm,
really should get periodically and just make sure, even if it's not every day, at least once a week, so you can kind of have an idea. Even if you have no blood pressure issues and you feel like it's perfectly normal, still check it every now and then.
because you need to know what your norm is.
Yes, yes. And then you need to know if you're getting outside of your norm, whether it's high or low. Mhm.
Continuing with numbers, what are good cholesterol numbers? And I know before we leave blood pressure, these are things people ask. You have a top number and a bottom number on blood pressure.
Mhm.
Explain what that is.
Okay. So when you have the blood pressure, like we mentioned, it's 120 over 80 is a normal. The top number is when the heart is contracting. We call that systolic number. All right. That's when the heart is contracting, means the heart is squeezing. The bottom number is when the heart is relaxing. We call that diastolic. Okay. So some people, I always get this a lot. Well, which number is more important? Which one is, more dangerous to be off? And I said, well, they go hand in hand, but you really don't want your bottom number to be overly high above 90 consistently, because that's your heart's relaxation. And if it's relaxing and it's high, that means there's a problem somewhere. There's something that's causing that pressure to stay high. So I encourage you to know both top and number. Both are equally important, but definitely if you start seeing high numbers on your bottom, something is going on with your body that needs to be addressed.
Hmm,
Yeah.
good.
Mhm.
Cholesterol numbers, and I've heard some changes recently in the last. So, what are good cholesterol numbers? And I know we have, there are different types even with that.
Yeah.
Good
Yeah.
cholesterol, bad cholesterol, all that. So let's talk more with numbers. Tell us about cholesterol numbers.
Okay. So your cholesterol numbers, so your overall cholesterol should be greater than 200. I mean, less than 200. I'm sorry. If it's greater than 200, that's considered high. So within your, we call it a lipid panel. It kind of breaks down different types of cholesterol that our body holds on to. So your total cholesterol, you want it to be less than 200. And then we jump to our LDL, which is what we call the bad cholesterol. That's the one that sticks to the arteries of the heart. It sticks to the arteries in the brain. It sticks to the arteries in your carotid area. So you want that number to be less than 100. So before it used to be 130. Now they've changed it to 100. Some people have certain conditions like coronary artery disease, or they may have had a stroke, and their numbers even need to be a little bit less. They need to be less than 70. So that part, I know that's going to be hard for everyone to kind of grasp. So it may vary from person to person, but a good number to aim for that bad cholesterol should be less than 100 on your LDL. And
Mm.
that's the one that sticks to our arteries.
Now, there are no home tests for cholesterol. You have to go to a doctor or a lab for that, rather.
Correct. Yes.
Mhm.
Yes. Yeah.
But it's important. And after we get through this numbers, we're going to talk about some preventative things. So let's hit diabetes, because you said diabetes impacts our heart as well. So,
Yes.
what are the numbers we need to look for?
So with diabetes, you got to know your what we call an A1C, and that's a number that tells you how well your sugars are controlled over the course of what we call a red blood cell lifespan, which is 120 days. So that's how well your blood sugar is doing over the last 3 months. So some people might say, well, I don't want to check my blood because I know I've been eating bad for the last 1 week. But your A1C will let you know how bad you've been eating over the last 3 months. So we can't really fool that one. So there are levels where you can do a what we call a spot check on your glucose. Those numbers vary. You want to aim around 120 and less. But your A1C is very indicative of how well your sugars are controlled. A1C should be around between 4 and 6%. All right. And then if you're diabetic already, you have a different window that you have to kind of work with. We want you less than 7%, less than 8%. All right. And then the higher your A1C is, as you start hitting 8%, 9%, 10%, you are probably causing some damage to your arteries. All right. Think of sugar. You know how gritty it is.
Mhm.
So when that grit starts to stick to our arteries, it can cause a lot of damages. Yeah. So that one too is very key to get with your provider and make sure that they do that periodically. I think the average person should have it checked once a year. If you're diabetic, you may have it checked more often with your primary doctor because you're on certain medicines and they want to make sure you're staying within a good range. Yeah.
We're going to talk about food. Let's go on and jump in. Talking about food and your blood pressure, food and cholesterol, food and diabetes. You mentioned salt and blood pressure. We do know
Mhm.
there's
Yeah.
really there. Eating too much sugar, starch, and things that turn into sugar in our body,
Right.
bad for diabetes. But what are some things you can say about food on the positive side? Can we know, okay, I can't eat this. What can I eat? So let's start with blood pressure. Are there foods other than say I'm avoiding salt? Are there things that can impact our blood pressure with food?
Yeah. So yes, your blood pressure, and I encourage as we talk to our patients, and when you're in cardiology, you don't want to just throw medication at a patient. You always want to try to see if we can go back to the basics. How can we change our lifestyle? So you already said it, Miss Lucas. You already said that salt is a very strong preservative that does raise your blood pressure, and the more salt you intake, the more our blood pressure goes up, the more damage we do to our heart. So if you incorporate a diet, and this goes for blood pressure, cholesterol, and diabetes, if you have a diet that's high in fish or lean meats, like your lean chickens, more vegetables, you can't go wrong with that. If you think about it, back in the day, they lived a long time, but it's because they ate more natural grown foods. The processed stuff that we eat, unfortunately, the fast food, that's what really gets us. That is all the preservatives that are put in there, all the sugar. they sell it to the masses, so they got to make it taste good. So we have to start incorporating more vegetables in your diet and more lean proteins, like your beans, like your fish, like your lean chickens. And then it's not to say we hate to be like, you can't have this, you can't have that, you can't have that. Everything is a balance. So whether you have blood pressure, cholesterol, or diabetes, you just need to make sure that your plate, when you're eating, try not to have so much starch, but balance it. A little bit of starch, a little bit of protein, and more vegetables. If you're diabetic, you have to be careful of the fruit, but add in those fruits in there. So I know it seems like we're so restricted, because I've had a patient that would ask me, well, Jenny, how can I eat if I have diabetes, cholesterol? I can't take this. I can't eat this. I can't. I said, well, everything is in moderation. Just think about it. More vegetables, okay, and less of the fries and the saltiness. It's not to say you can't have any of that stuff, but you have to just reduce it. The same thing, some people ask about, your alcohol and your drink intake. You can get a lot of calories and a lot of toxins and stuff that affects your blood pressure and sugar with alcohol. If you have a holiday, yeah, that's one every blue moon. But if it's on a daily basis, you're doing some damage. So just everything in moderation. And if you have certain conditions, that's where you would talk to your doctor about, what do I need to stay away from and what can I avoid. But a diet that's high in vegetables and lean meats, you can't go wrong with that.
And I always like to remind people, when you read labels, see what it
Mhm.
says.
Yeah,
And if it has so many things on there that you cannot identify, maybe you need to leave it alone. When you talk about the preservatives, it's like, huh, I don't know what that is. I don't know what that is. I don't know what that is. And you keep reading, well, then you don't know what you're putting in your body.
exactly. Yeah. When you can prepare your own food, majority of your own food, you know what you're putting in and out of your body. But when you just picking things up, that's a risk that we take the more we eat out.
Hmm.
Mhm.
Now, the name of the show is Black Mental Health is Black Health. And the whole idea behind that is our physical health and our mental health are combined. It's just health, different
Yeah.
sides of the same coin. And we're talking about the heart. Are there any relationships? I know the answer, but I'm going to let you tell us any relationship between heart health and mental health, because it's our heart, it's our mental health. Surely, there's a
Yeah.
relationship.
Yeah, it's very important. Like I say, you can add in a lot more to it, but what we were taught in school was that, if you think about it, think of and I try to make it so that you can understand where I'm coming from. When you think of your fight or flight mode, right? If you have a lion or a bear standing face to face with you, you're not going to be like, oh, what am I going to eat tomorrow? What am I going to do tomorrow? No, you are going to go into that fight mode. You are ready to run or fight to defend for your life, right? So when that happens, we have certain stress hormones that are released in our body. Because at that time, you don't want to be thinking about food. You're thinking of, how am I going to survive? So your body is pumped with endorphins and stress hormones that say, you better fight. And when your body's in that state of stress, you're able to do mighty things. You'll be surprised, right? You'll be able to run faster than you thought you could. You'll be able to, take on the world at that time. However, when you are constantly in a state of stress and your mental state, there is an imbalance, you do run the risk of having high blood pressure. Your blood pressure will go up because your body's in that stress mode. Your heart rate will go up. Like I said, your cortisol levels, your stress hormones will rise. And when your body's in a constant state of stress, you are putting pressure on your heart. You're putting damage on vessels that go from the heart to the brain, that filter to the kidneys, that filter to your lower legs. And when you have anxiety, when there is depression, when there is panic disorder, and so many, when the peace of mind is imbalanced, you do run the risk of having heart disease later on, because your blood pressure is constantly high or your heart rate is constantly high. You run the risk of having heart disease. So some people may say, well, how does that relate? But yes, you're internally doing damage. We've seen it quite a bit. Someone could be going through maybe a very stressful situation. All of a sudden, they start having chest pain. Or someone that went through an argument, or they're grieving on someone, for their loved one. All of a sudden, they end up in the emergency room because they're having chest pain. their insides or stress hormones are so high that it's causing issues, and we've seen that. So stress can lead to heart attack, prolonged stress. So I definitely recommend for my patients, like, if there's any kind of mental disorder, the same way you treat your blood pressure, you would want to treat your sugars, is the same way you want to get your mental health sorted out with a counselor. And, Miss Lucas can go into more detail about that, but you have to take it seriously and make sure that there's a balance. See a doctor, see a provider that can help get you on the right track. But Miss Lucas, you can add into more about that. Yeah.
And I will say that as a mental health professional, we work with doctors. Doctors will refer patients to see a counselor, and counselors will say, "Have you seen your doctor?" I ask all my new patients, "When was your last physical?" Because a lot of physical, not just your heart, but a lot of physical ailments can impact your well-being, like thyroid. One of the byproducts of being hypothyroid is depression. Uh,
Mhm.
Diabetes and depression go together. So yes, it impacts that. One of the things we're talking about stress. One of the things about stress and our mental health and our heart right now, being Black in America is stressful.
Mhm.
And right now, just being in America is stressful. I have seen several clients who are more stressed since the election and the change in the new year with the new administration. It has really stressing people out.
Mhm.
People who work for the government, their stress level is high. Things are changing. People who don't know how this is going to just impact them. People who've been working at home for 5 years and in 2 weeks you go into the office. It changes just everything. I haven't had to drive in traffic for 5 years. I don't have the clothes for it.
Mhm.
I'm so used to not being around people, and it really causes stress. So
Mhm.
those things that do that, those things that we're dealing with can truly increase our stress level, and you feel it. So when it comes to anxiety, there are physical manifestations of anxiety, and racing heart is one of them. People who experience panic attacks, people who are under stress, some describe, my heart was just racing and I didn't know what to do. Like I couldn't breathe, and you really can't. And you can
Mhm.
stress. Some people feel it in their shoulders, some feel it in their stomach, some get headaches. So, but it physically impacts you. And like she said, anytime you are physically impacting your body, it can impact your heart.
Yeah. Yeah.
So
Yeah.
yeah, it is so tied. Someone asked in the chat, how can we check our blood pressure at home? There are I don't know what you call it. What do you call the thing you check your blood pressure with? When you
So,
go.
blood pressure machine.
Oh, that's it. Okay,
That's
okay.
it. Yeah. So, yeah, I'll actually grab one. I have one over here. But blood pressure machine, yes, you can get them anywhere. Amazon, Walmart, CVS, Walgreens. They have them everywhere. Sometimes, like with our clinic at Hartful, we actually have a program where if your insurance qualifies, they'll send you the blood pressure machine to your house. Every time you check your blood pressure, it is being sent to a provider, and that provider keeps an eye on it. If your numbers start going up, they'll call you and say, "What's going on? How are you doing? Is anything going on with your meds? Are you missing anything?" And they'll talk to you. Or if the blood pressure is going low, they will call and say, "Hey, we see a change in your flow of your blood pressure." So there are programs with your providers that you can get linked with, where they can just all they do is they send you, like, it's basically it's just an automatic. It goes straight to your doctor's office, and they keep a track of it, and they'll let you know if they start seeing changes. Yeah, but you can get a blood pressure cuff pretty much in any of the stores like Walmart, Target, CVS, Amazon. They all have it.
Mhm. Believe it or not, we have come just about to the end. And we always sign off with a call to action. But before I do the call to action, what final thing would you like to say? Take a minute or so and tell us one final thing you want to say about overall heart.
So overall, like we said, we've talked about so many different things. The main thing I would say, please just get a provider. When you are over the age of 18, things are happening in your body. Get a doctor that you can see at least once a year. That way they can check things. They can just be on the lookout for you. Doctors are there to help you. You don't have to figure these things out if you have it. But if you have a doctor, they can help you check certain things. And I will encourage you. There are some people may get discouraged. Well, this runs in my family, that runs in my family. Yes, just because it runs in the family, it doesn't mean that you have to have it. Your lifestyle changes will make a difference. So exercise, move 30 minutes a day. You don't have to have a gym membership. You turn on your favorite show and you walking the entire time your show is going 30 minutes. You've gotten your activity in. Garden, walk longer, park further out when you're at work or you're at the grocery store. So just move more. When you exercise, your body breaks down the things that it doesn't need. So you can get a lot of benefit from just daily exercise and movement, and then watching what you eat. Everything you have Dr. Google there that will give you a lot of recommendations on heart healthy way of eating. So I encourage us all to just get a doctor, be more active, and then just watching what we eat.
Awesome. And that's our first, what she said is our call to action. And finally, I'd like to just ditto and say, get that doctor. If you are dealing with any mental health issues, you see how it can impact your physical health. Take care of your physical health, take care of your mental health.
Yeah.
Final call to action has been for years and will be for years. Vote, vote, vote. How does it fit? Who's in office, who's in different places can impact your physical health, your mental health, and your access to health. So vote, 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 but be an educated voter. Just don't go vote for or against a party. Be an educated voter and take care of your health. Dr. Genio, I want to say, I want to say thank you for coming out and informing my audience about the importance of our health.
Glad to have been here. Thank you for having me.
You're welcome.